Today, we're diving into a true medical mystery. It's a high-stakes drama where the very sac designed to protect the heart actually starts squeezing the life out of it. We're talking about cardiac tamponade, so let's get right into it.
This, right here, is the best way to picture what's happening. Your heart is trying to beat inside this tiny confined space, but fluid is building up all around it. The pressure just climbs and climbs. The heart literally has no room to expand. It can't fill up with blood properly, and suddenly, it's in a desperate fight for its own space. That is the heart of the problem with cardiac tamponade.
All right, so let's dig into the core problem here, the actual physics of this pressure cooker situation. Because it turns out it's not just about how much fluid is there, but, critically, about how fast it showed up.
Now, this graph is really fascinating because it shows you just how important time is. That sac around the heart, the pericardium, it actually has a little bit of stretch to it. So fluid builds up slowly, over weeks or even months. You can follow that blue line. You can see the sac stretches and can handle a lot of fluid before the pressure goes crazy. But look at that red line. That's what happens when fluid builds up fast, say from an injury. The sac has zero time to stretch. It hits its limit, and bang, the pressure just skyrockets, causing a major crisis with way less fluid.
So as this intense pressure is building, the body doesn't just sit there and take it. Oh no, it fights back. And this whole crisis unfolds in three pretty distinct phases. Let's walk through how this thing escalates from a concern to a full-blown, life-threatening emergency.
Okay, so in phase 1, things are getting tight, but the pressure outside the heart is still lower than the pressure inside when it's trying to fill up. So for now, the heart is keeping up. But then comes phase 2. Now, the outside pressure is high enough to match the filling pressure on the right side of the heart, which is the lower pressure side, and it starts to get squeezed. This is the point where the cardiac output, the total amount of blood the heart is pumping to the body, starts to drop. And then, phase 3. The external pressure is now so intense, it's equal to the filling pressures on both sides of the heart. The heart is getting seriously crushed, it just can't fill with blood, and the body's blood pressure absolutely tanks.
But right in the middle of all this chaos, the body gives us this really strange, very specific clue. It's a phenomenon that's so weird and counterintuitive that for over 100 years, it's been one of the biggest keys to solving this medical mystery.
It's called pulsus paradoxus. Now here's how it works. Normally, when you take a breath in, your systolic blood pressure, that's the top number, drops a tiny little bit. You'd never notice it. But in a patient with tamponade, that drop is massive. We're talking more than 10 points. It's a huge red flag for doctors, and the reason it happens is just fascinating.
So it all comes down to this idea of ventricular interdependence. Just think of the right and left ventricles as roommates, sharing a single room with a flexible wall between them. That's the septum. And that room is inside that fluid-filled, unstretchable sac. So when you breathe in, more blood rushes back to the right ventricle. In this super cramped space, the only way for it to expand is to shove that shared wall over into the left ventricle space. It literally steals room from its neighbor. This means the left ventricle can't fill up as much, so it pumps out less blood, and poof, your blood pressure drops. When you breathe out, everything just snaps back.
And this right here? This is what that looks like in a real patient. This is a live feed from an arterial line. You can see the normal peaks of the heartbeat, but just look what happens when the patient breathes in. See that huge dip in the pressure? In this case, it's a 25-point drop. That right there is pulsus paradoxus caught in the act.
Okay, so with huge clues like the paradoxical pulse pointing them in the right direction, how do doctors actually confirm what's going on? How do they get a definitive look at the scene of the crime?
Well, doctors are trained to look for a classic triad of signs called Beck's triad. You've got low blood pressure because the heart can't pump effectively. You have bulging neck veins because all that blood is backing up trying to get into the heart. And you get muffled heart sounds because the fluid is literally acting like a sound barrier. But even these are just clues.
The real key to cracking this case is the echocardiogram. It's an ultrasound that gives doctors a live, moving picture of the heart, and it lets them see this whole pressure cooker situation in real time.
And here's what they see. The very first part of the heart to give in is the right atrium. It's the chamber with the thinnest walls and lowest pressure, so it's the first victim. You can see it right there collapsing inward at the exact moment it should be opening up to fill with blood.
And as that pressure just keeps climbing, the next chamber to go is the right ventricle, the main pumping chamber on that side. Look at that. You can see it actually buckling inward while it's supposed to be relaxing and filling.
The squeeze is definitely getting worse.
And finally, this shot shows the ultimate consequence. You've got a total gridlock. Since blood can't get into the heart, it backs up in the veins leading to it. This huge vein, the inferior vena cava, is supposed to be emptying blood into the right atrium. Instead, it's swollen up like a balloon because the blood has absolutely nowhere else to go. At this point, the visual evidence is just overwhelming.
So, the diagnosis is crystal clear. The solution seems pretty simple, right? Just get the fluid out. But in medicine, sometimes the cure can create its own crisis. And yeah, this story has one final, very dangerous twist.
The life-saving procedure is called a pericardiocentesis. A needle goes into that fluid-filled sac to drain it and relieve all that pressure. And often, the relief is immediate. But releasing all that pressure at once can unleash a completely new and powerful problem.
It's called pericardial decompression syndrome. Now, it's pretty rare. We're talking less than 5% of cases, but it can be incredibly deadly, with mortality rates as high as 30%. So the very act of saving the heart can, in some cases, send it into a state of shock.
And this explains that paradox. When you yank away that external pressure, it's like opening the floodgates. All that blood that was backed up in the body comes rushing into a right ventricle that's been starved for flow. It suddenly overexpands, and in doing so, it slams that shared wall, the septum, hard over to the left, and now it's crushing the left ventricle.
Doctors know they need to be extra careful in certain situations. Patients who've had a lot of fluid build up slowly over time are at a higher risk. So is anyone who has a large amount drained really quickly. This is why, sometimes, they'll just drain enough to get the patient stable and then take the rest out slowly over the next day or so.
Which really leaves us with this final incredible thought. Cardiac tamponade is a frantic race against time and pressure. But as we've just seen, even the solution itself carries its own risks. It's a powerful reminder of the delicate, high-stakes balancing act that is emergency medicine, where every single decision has to be weighed, not just against the disease, but against the potential consequences of the cure itself.